Completed in 2016, the new Stamford Hospital is located less than an hour from New York City and overlooks Long Island Sound. We are a 305-bed, Level 2 trauma center featuring state-of-the-art facilities and resources to provide the highest quality of care for our patients. Core to the mission of Stamford Health is a commitment to medical education. As a teaching hospital, we sponsor accredited graduate medical education programs in family medicine, internal medicine, general surgery, and obstetrics and gynecology. And we serve as the major teaching affiliate of Columbia University Vagelos College of Physicians and Surgeons.
The kind of world-class academic affiliations we have attract some of the best faculty from around the country, and by extension, we attract the best residents to our program. In the ideal vertically integrated model, your best medical students become your residents, and your best residents become members of your medical staff. And so being a teaching hospital is really an ongoing investment in that future.
So my sub-internship experience here was great. This was far and away the nicest hospital, the best culture, the best people that I experienced at any hospital in the state. And that led me to put Stamford Hospital at the top of my list for matching.
I picked Stamford because it pretty much hit every point on my list that was important for me to have in a program. Working in a collaborative environment, being able to work with other programs, with the surgery residents, with OB, with internal medicine, directly with our pediatric hospitalists was very important because in the real world, we're all part of a medical team, even if we're in different subspecialties.
The attendees that you meet here are people that could work anywhere in the United States. They just chose to practice here in Stamford, and that's a huge advantage that we have.
With partnerships that include Hospital for Special Surgery and the Dana-Farber Cancer Institute, Stamford Hospital has been honored as a magnet organization for our excellence in nursing. We are also one of only 7 hospitals worldwide to be awarded the Plaintree Gold Certified distinction for our person-centered care.
Plaintree helps us to think about what best practices we can put in place to make sure we create a human-centered experience for all of those who come in our doors. We're dedicated to making sure that we create a healing environment, that we are focused on diversity, equity, and inclusion, and that we include our patients as care partners in all of the work that we do.
DE&I is at the forefront of everything we do, making sure that caring for patients in this very diverse area, having a very diverse staff, making sure that we speak to patients in their preferred language, making sure we're inclusive of everyone in everything that we do. Supporting our patients, supporting each other, really provides a robust environment for learning and for providing care.
We have a lot of resources available. There's social workers and community health workers within our clinic that are able to assist us, and we also have very good resources for patients who are uninsured or underinsured and able to provide them all of the care that they might need, including medications, procedures, everything we can get done because we're taking care of people really well.
The resident council is made up of house staff members selected from each of the 4 programs.
The intention of the resident council is to provide a forum for residents to bring forth concerns or suggestions they have regarding their clinical training, their academic curriculum, or just their working conditions. This includes the health and well-being of our residents, for which we've made capital investments, such as the build-out of call rooms and new office spaces for the residents, as well as enhancements to their compensation and benefit packages.
Resident wellness is really supported by the hospital, and there are so many different ways that wellness is part of my day. Not only do we have parking available to residents in the physician parking lot, which is right behind the hospital, there's also food allowances for residents. We also have a resident lounge, which is well stocked with coffee, tea, and snacks.
We have an internal concierge program for all of our staff, where whether it's dry cleaning, car services, shoe repair, jewelry repair, planning your vacation, they'll wrap your holiday gifts for you. Really makes an impact. And the whole idea behind this is to support you and allow you to just focus on what's important, caring for our patients.
At Stamford Health,
For graduate medical education, you'll get the best of many worlds. Not only will you have academic rigor and evidence-based teaching, you'll have it in a collegial, caring, nurturing environment located at a community hospital that's been taking care of patients for 100+ years. Administration has shown its support for residency education recently by increasing resident housing stipends and making sure that our residents are able to function and live well as they get through the challenges of residency education.
We want our residents here at Stamford Hospital to thrive, not just professionally, but also personally. We provide a supportive and nurturing environment where they can care for their patients and learn to become competent and compassionate physicians in whichever of the 4 specialties they'll be choosing to join. Some of the specific programs for the residents include lectures on developing a personal well-being plan, managing stress, and preventing burnout.
We take burnout, depression very seriously here. When you're dealing with life and death issues, when you're having hard conversations with family members who are learning about their loved ones' diagnoses that can be life-altering, these are extremely hard conversations, and it's normal for you to feel upset and overwhelmed. Sometimes the people that you have in your personal life are enough to support you through those moments. And other times you might need professional help, and that is okay too, and we have resources available for you if you do need that.
The residents are not alone when they're doing research here at Stamford. We offer full support by helping them write their research protocols, hammering out ideas, as well as through data collection and statistical support. Best way to highlight research here in the system is the annual Stamford Health Research Day. 5 to 10% of the projects that are presented at Research Day are published in top-level journals. Another 25 to 35% are presented at national meetings. The Department of Research and Discovery also supports education for our residents through the Center for Simulation and Learning, where learners can come and work on a variety of different types of simulators, from low fidelity to high fidelity, or also immerse themselves in virtual reality training.
Stamford is a great place to live and to work. There's tons of stuff to do in the area, lots of restaurants, beaches, and anything that you want to do that you can't find in Stamford. You're just a 45-minute train ride from Manhattan.
There's lots of social events for the residents outside of the hospital. We get together all the time. I've been to numerous dinners. Even the program directors, they make an effort to get to know people's families, get to know their situation, and are really accommodating.
I'm someone who thinks that quality of life is important. I believe in that. I think that happy minds learn. I think healthy minds learn. I live in a beautiful apartment that I can afford. I eat well. I sleep well. When you're trying to decide where you want to go to residency, you need to put a premium on where you're going to be living. It's going to be a hard time of your life. It's going to be a stressful time. And you want to feel that when you leave the walls of your hospital, you're not entering another stressful environment.
Being part of a small program means you don't disappear into the background. You're given a lot of responsibility up front,
but also a lot of support from your colleagues and your program directors.
So I'm very busy as an intern, but I feel more than supported. It's a great environment. Everyone's always willing to help you with your patient, help you figure out a treatment course, how to work this system, that system, who to call, when to call. I've never felt left out in the cold once.
Being part of a small program means
they're also not competing with fellows for access to the faculty or clinical experiences. For our surgery and OBGYN residents, the amount of OR time they have and the breadth of cases they scrub into eclipses anything they would experience at a large academic medical center. For our internal medicine and family medicine residents who spend a lot of time at our FQHC clinics, they're being exposed to a very diverse patient population and are caring for a wide variety of pathologies and levels of acuity that leave them extremely well prepared to handle anything that comes through the door.
We actually don't have fellowships at our hospital. So what this means is that most of our cases from day one, you are the first assist. By the time you're fifth year, you're doing fellowship level cases as a first assist, where you're the only other doctor in the OR. This really makes you grow as a surgeon over time and prepares you to go into a fellowship feeling really experienced and ready to go.
When you look at a residency program, a lot of people are looking to go into a fellowship. When you look here, you see that people all match in top flight fellowships. We work with excellent attendings, and you're going to match well, and that's really what you're here for.
a large number of our residents go off to do fellowships. They're extremely well-prepared clinicians, and they could succeed anywhere. Interesting thing is the large number who choose to stay in the area and become members of our medical staff itself. And within our hospital, a number of our residents have gone on to leadership roles.
I was actually an intern here and have stayed here and started solo practice and then a group practice. And now I'm the chief physician executive. That's comparable to chief medical officer at many hospitals. I can guarantee you that you will get great training here at Stamford Health, and that will allow you to be very successful no matter where you end up.